First, thank you, Senator, for that kind introduction. Thank you, Chairman Moran, Ranking Member Blumenthal, Chairman Bost, Ranking Member Takano, and distinguished members of these committees. On behalf of the 2.5 million members of the American Legion family, I appreciate the opportunity to discuss our legislative priorities for the second session of the 119th Congress. I would like to begin by introducing the members of the American Legion family here with me today. Please stand if you are able as I recognize you, our national officers serving with me this year. Please stand. Our past national commanders, please stand. Pam Ray, National President of the American Legion Auxiliary. William Clancy III, National Commander of the Sons of the American Legion. And my daughter Christy, my son Austin, and his wife Jessie with their son and my grandson Noah, and of course, the most important person in the room without a doubt, my wife Sonia. Thank you. Our written testimony contains our complete list of legislative goals, and they are all important. With limited time, however, I will focus on several critical issues. This is a pivotal time for our country. Recent military action reminds us of the cost of service, shouldered by a shrinking minority of American families. In our all-volunteer force, military service has become a family business. And while average time in uniform is just 4 to 8 years, the cost can potentially last a lifetime. And as we mark the 250th anniversary of our nation's founding, it is essential we examine those costs and make sure they are paid in full. That is precisely why Congress chartered the American Legion after World War I, to promote a strong national defense, encourage civic education, and to create a community of veterans to support one another whose voices are heard by our nation's leaders. Since 1919, the Legion has been instrumental in landmark changes like the GI Bill, creation of the modern VA, appeals modernization, and the Mission Act. We created programs like the American Legion Child Wellbeing Foundation, Legacy Scholarships, and Boys Nation. Our mission every single day is to serve those who served us. At the post level, Legionnaires serve their communities in times of crisis. Just last year, after the tragic floods in Kerrville, Texas, Legion Post 208 provided urgently needed resources for those who had lost everything and served as a relief point for aid workers who came from across the country. American Legion service officers assist veterans with disability claims, and in 2025 alone processed $29.5 billion in claims for veterans. This was free of charge, regardless of whether they were members of the American Legion or not. Nationally, we partner with VA on the Buddy Check Week and our Be the One campaign to reduce stigma, provide critical training, and ultimately save lives. Our System Worth Saving and Regional Office Action Review programs provide policymakers with on-the-ground feedback regarding health care and benefits. And we have continued to work with Congress to ensure that while the administration seeks bold change, there is no reduction in accessibility of services and benefits to any veteran or their family. Just 2 weeks ago, the American Legion spoke against a proposed rule that would change the way VA rates a veteran's disability based on medication management. We were glad to see Secretary Collins listen to the veteran community and ultimately rescind the rule. We will remain vigilant, and we will give you all of our feedback on what is working and what needs to change. The Legion's #1 priority is ending veteran suicide. VA estimates more than 17 veterans die every day by suicide. Traditional approaches to this problem, pills and therapy, have objectively not worked. We need stronger transition programs, innovative therapies, and improved safeguards to medication management. That's why we support things like the Fox Grant Program, the Beacon Act, the Written Informed Consent Act, and other bills that seek to address this problem. It's also why, after a decade of Legion advocacy, I was proud to be in the Oval Office as the President signed an executive order reclassifying cannabis as a Schedule III drug. This allows for federal research on how it can reduce drivers of suicide. Now, the American Legion does not support use of illegal drugs, but we strongly support research that could result in new, effective treatments. An important part of suicide prevention and ultimately VA's core mission is access to timely, quality health care. And while most veterans prefer to receive from VA their care because it's a one-stop shop, community care has exploded since the passage of the Mission Act. Congress must provide the necessary funding to ensure the VA system remains strong without curtailing a veteran's access to community care if it is in the veteran's best interest. It is a difficult balance, but one we are committed to helping Congress achieve. Ultimately, veterans should get the care they need when they need it. But we must remain the center of all veteran health care in the VA. As we discuss VHA reorganization, the next-gen community care contract, and acceleration of electronic health record deployment, Congress must also address aging infrastructure and give the VA authorities and funding it needs to compete with the private sector job market. As we all know, the veteran population is changing, and so are its needs. Women's veterans, the largest growing subpopulation in our community, experience homelessness, depression, infertility, migraines, and other issues at a higher rate than their male counterparts. This is attributed to military sexual trauma and domestic violence. Congress should pass legislation to improve research on how issues unique to women veterans, including menopause, affect outcomes and increase the availability of gender-specific rehabilitation programs. Enabling veterans to thrive in a civilian life is a huge task. Congress can make it easier by ensuring our service members don't experience financial uncertainty prior to separation. When I served in the United States Air Force, I never worried about getting paid on the 1st and the 15th of the month. But as government shutdowns become more frequent, that is no longer guaranteed. Now, not long ago, the Legion provided over $1 million in grants to Coast Guard families because Congress failed to do its job and ensure they were paid on time. We need ironclad protections to ensure uninterrupted pay for all service members in our all-volunteer force. Finally, consider Major Richard Starr, who deployed multiple times and was diagnosed with lung cancer linked to burn pit exposure. Before his death, he endured the indignity of a wounded veteran's tax, an offset of his disability compensation against his pension because he was medically retired before 20 years. This is wrong.
They're all standing.
Collecting both benefits is not double dipping. Retirement is for time served. Disability compensation is for harm caused during service. Congress must pass the overwhelmingly supported bipartisan Major Richard Starr Act. Chairman Moran and Bost, ranking members Blumenthal and Takano, and members of the committees, the way America treats its veterans directly influences whether the next generation raises their right hand to define our 250-year legacy. On behalf of the entire American Legion family, thank you for this opportunity to share our priorities, and my staff and I welcome your questions.